Hey guys, Dr. Ray Marquez here, your Violent Area chiropractor. I'm at home with my #1 chiropractic assistant, Chloe. Say hi.
Hi.
And today we are going to review an at-home blood pressure cuff. Now I know blood pressure cuffs don't really have a lot to do with your back or neck pain, but I think it's crucial in knowing your blood pressure, especially if you're having a problem from day to day, and you might as well be able to check at your house instead of waiting to go to the doctor's or even go to the pharmacy to check it out when there's a lot of good products out there that you can do at home. Today we got this Omron blood pressure cuff that's meant to be used at home. You want to show them? Over a little more, I can't say. There you go. We got this one right at CVS, and I got this brand because we use this one in the office actually. I did make a mistake in buying it. I thought it was a wrist one that we use. This one is actually one for use for your arm. So we're going to check it out, review it, and see what we think. So we opened it up. Obviously, it came with instructions.
You can get that CPS.
At CVS, that's right. CVS. And it came with 2 different pieces. It was just 2 pieces. So I guess the actual unit that does it, and then the part that you put your arm on. So you want to show them that, babe? Yeah, we're going to do that in just a second. We'll put that around my arm. I'll let you do it, but why don't you show them? All right, so 2 easy things. The one thing that I was disappointed a little bit is that you had to buy your own batteries. Luckily, I had a bunch at home, but I know if I had bought this and didn't have any at home, I would have been a little upset. Luckily, we have Chloe here, and we got batteries for everything, so we were able to do it. So maybe that was one little disappointment. The next thing is easy to set up. All it is tube in here. We put it right into the unit. What kind of batteries? These are double A's.
You get double A's for this.
So how many? 4 double A batteries.
4 double A's batteries.
Okay. All right.
And then that little attached part, and then you just put it on.
Just put it right on that attachment. You want to try to put it on? So see, so easy. A 6-year-old can do it. Chloe's actually 5, but when are you going to turn 6?
6 more days.
6 more days, she's going to be 6. All right, so looking at it without even looking at the directions or anything, it looks like we push this one little button to turn it on. Why don't you try to turn it on there, hon? Yep, that looks like it turns it on. I'm going to put the blood pressure cuff on myself.
Because I'm 5 and it looks like it hurts.
So
and it might hurt a little on me.
Couple of things here. You know, I know if I was home by myself and my arm was a little bigger, this may be a little difficult to put on. So I know the same brand, Omron, makes a wrist one, which I originally first thought I was buying. I think I would go for the wrist one to be a little easier to use. If your arm's a little smaller or you don't think you'd have difficulty doing it, I think the arm cuff would be just fine. All right, so the next thing we do, I guess we got a little start button on there. I'm going to have Chloe start it. So press the big blue button. Okay, right now I feel it pumping up. Seems pretty comfortable.
How long do you do?
How long? That's a good question. We're going to just let it keep on pumping until it tells us to stop. You can see right now it's pumping up. So I'm going to try to relax here for a minute, make sure my blood pressure's not too high.
What does it mean when it's too high?
That's a good question. So if it's too high, that means my heart might not be healthy and I need to take steps to make it lower.
And it said, no, you're okay.
That's right, if we're in the normal range. So the normal range is 120/80. So we had an error. It comes up with an E2 error.
And the bad might be like 100 or something.
Well, maybe a little lower than that. So we had an error, maybe because I was jumping around. First time we're using it, so we're going to try it again. So I'm just pressing the start button again. Doesn't seem to be going right away.
So maybe for like 5 or 10 minutes?
No, it didn't take 5 or 10 minutes, just a few seconds there. I was pressing it a bunch. I think you just got to press it and stop it and it'll get going again. So I won't talk a whole lot here. I'm just going to try to get to relax. See if we get a good blood pressure cup.
And maybe I will just show you some stuff.
Yeah, you can show them the battery thing maybe. Also, I'm noticing here why it's taking my blood pressure. It's also taking my pulse, which would be nice to know. All right, right now I just did that reading. It said my blood pressure is pretty high. I'm not sure how accurate that is. It says 157 over 106. I'm a little skeptical of that. I'm sure it's a little lower. At least I hope it's a little lower. So what I might do if I was home and I had this high blood pressure, what I would do is I would check this every single day, right about the same time each day. So say I do it at night like we're doing now, I would check at the same time. If it were to continue to stay high, the first thing I would do is get a hold of my primary doctor, discuss with him, make an appointment, and get in there and have a professional take it.
Maybe before you get this, you make sure your arm is like not too small.
That's right. So what I'm going to do as part of this whole video series we're going to do, I'm going to check my blood pressure every day with this Omron arm blood pressure cuff and keep you informed where it is. So number one, if I get a high reading or you get a high reading at home, make sure you make an appointment with your primary or your local doctor or even the urgent care if you need to, and make sure that everything's okay. If you start to feel lightheaded, sick, or dizzy or anything like that, always call 911 or the ER. Say it again. Go ahead. Go ahead, say whatever you want. All right, so again, the Omron, if I were to rate it, I guess I'm going to give it a thumbs up. I'm going to give it a thumbs up, babe. Pretty easy to use. I'm not sure about the reading so far. I'm going to do a bunch. We'll give it a better thumbs up once we know if the readings are accurate. But as far as putting it together, everything seems pretty easy. Again, I think I would have went for the wrist model. I know that was a few dollars more. This one was $50. So hey, if your arm can fit in the cuff and you're okay with that for $50, it's probably a pretty good thing. Again,
you can maybe order it and get online. Yeah,
you could probably get it online if you look for it. Again, no matter which brand it is, if you use the same machine around the same time of day, under the same circumstances, and you do it from day to day, whether that reading was accurate or not, it still can give you a good idea of whether it goes high or low. And you can see where you're progressing. Remember, always go through this with a healthcare professional, especially your primary or even your cardiologist if you're seeing one. And that's it. So we'll give it a thumbs up for now. We'll see you next time, and I'll take my blood pressure again. Let's say bye.
Bye.
Bye, everyone. Have a good weekend.
Bye.